Welcome everyone to Health Unpacked, where we dissect common health issues and bring you the latest in medical advancements. Today, we're tackling a topic that many shy away from discussing openly, but it affects millions worldwide: hemorrhoids. And we're going to talk about a game-changing treatment option, laser therapy. Dr. Fatima, it's great to have you here.
Thank you, Prof. Mahmoud. It's a pleasure to be here. You're absolutely right. Hemorrhoids, or piles as they're commonly known, are incredibly common. Statistics vary, but it's estimated that at least half the population will experience them at some point in their lives, especially after the age of 30. Yet, there's still so much stigma, and frankly, a lot of outdated information out there.
Precisely. And that stigma often leads to people suffering in silence for years, trying home remedies, or just hoping it will go away when effective, minimally invasive treatments are available. Let's start with the basics for our listeners. What exactly are hemorrhoids?
Essentially, hemorrhoids are swollen veins in your anus and lower rectum, quite similar to varicose veins. They can be internal, forming inside the rectum, or external, developing under the skin around the anus. They're often caused by increased pressure from things like straining during bowel movements, chronic constipation or diarrhea, pregnancy, or even just prolonged sitting.
And the symptoms, Dr. Fatima, can be quite distressing, can't they?
Oh, absolutely. They can range from mild discomfort to significant pain, itching, swelling, and bleeding during bowel movements. For some, internal hemorrhoids can even prolapse, meaning they push out through the anal opening, which can be incredibly uncomfortable and even painful. It really impacts quality of life.
Indeed, for years, the gold standard for more severe cases often involved surgical procedures like hemorrhoidectomy. While effective, they were notoriously painful, with a long and difficult recovery period. I mean, we've all heard the stories, haven't we? Patients often dreaded the recovery more than the condition itself.
Yes, traditional surgery was effective, but the post-operative pain and extended recovery time were significant drawbacks. Patients would often need weeks off work, significant pain medication, and still face discomfort for quite some time. It was a major deterrent for many who desperately needed treatment.
And that's where laser treatment comes in as a truly revolutionary option. It's transformed how we approach hemorrhoid management for many patients. Can you walk us through what laser treatment for hemorrhoids, specifically a procedure like hemorrhoidal artery ligation and rectoanal repair, HALARR, or laser hemorrhoidoplasty, LHP, actually entails?
Certainly. The beauty of laser treatment is its precision and minimal invasiveness. Unlike traditional surgery that involves cutting away tissue, laser hemorrhoidoplasty, or LHP, uses a highly focused laser beam to essentially shrink the hemorrhoidal tissue. The laser energy causes the hemorrhoid to coagulate and contract, reducing its size and the associated symptoms. It targets the blood vessels feeding the hemorrhoid, effectively shutting them down.
So it's not cutting, it's more like a targeted sealing and shrinking, isn't it? That immediately sounds less traumatic.
Exactly. No large incisions, no stitches in a very sensitive area. The laser fiber is inserted directly into the hemorrhoid, and the energy is delivered internally. This preserves the anal sphincter and the surrounding healthy tissue, which is incredibly important for maintaining normal function and drastically reducing postoperative pain.
That's a key point. Preserving the anal sphincter reduces the risk of complications like incontinence, which, while rare with traditional surgery, was always a concern patients had. What about the procedure duration, and is it done under local or general anesthesia?
Typically, it's performed under general anesthesia or sometimes spinal anesthesia, ensuring the patient is completely comfortable and pain-free during the procedure. The procedure itself is quite quick, often lasting only 15 to 30 minutes, depending on the number and size of the hemorrhoids being treated. Patients usually go home the same day.
Same-day discharge is a huge win for patients. So let's talk about the recovery, because this is where laser treatment truly shines in comparison to older methods. What can a patient expect in terms of pain and downtime?
The difference in recovery is quite dramatic. Because there's no cutting, there's significantly less postoperative pain. Patients typically describe it as mild discomfort or pressure, manageable with over-the-counter pain relievers, rather than the severe pain associated with traditional surgery. Most patients can return to light activities within a day or two and to work within a week, sometimes even sooner. This is a massive improvement over the several weeks of recovery needed for a conventional hemorrhoidectomy.
That's incredible. I've had patients who were so relieved by the faster return to normal life. It's not just about the physical pain, it's also about the psychological impact of being incapacitated for an extended period. The minimal invasiveness also translates to less bleeding, correct?
Absolutely. Because the laser coagulates the blood vessels, there's very little intraoperative or postoperative bleeding, which is another significant advantage. The risk of infection is also reduced due to the precision of the laser and the closed nature of the treatment within the hemorrhoidal tissue.
So when we talk about who is a suitable candidate, are we talking about all grades of hemorrhoids, or is it specifically for certain types?
Laser hemorrhoidoplasty is particularly effective for grade 2, 3, and even some early grade 4 internal hemorrhoids that are symptomatic and haven't responded to conservative treatments. For grade 1 hemorrhoids, dietary changes and lifestyle modifications are often sufficient. But for those persistent, more troublesome cases where banding or other office procedures haven't worked or are not suitable, LHP offers an excellent alternative to traditional surgery.
That's a good distinction. It's not a first-line treatment for every single case, but for those who truly need intervention beyond lifestyle changes, it's a fantastic option. What about the long-term effectiveness, Prof. Mahmood? Patients always want to know if it's a permanent solution.
It's an excellent question. While no treatment can guarantee 100% no recurrence, especially if underlying lifestyle factors like chronic straining or constipation aren't addressed, laser hemorrhoidoplasty has very good long-term outcomes. Studies show high success rates in terms of symptom resolution and low recurrence rates. The key is that it treats the root cause by shrinking the actual hemorrhoidal cushion and closing off its blood supply, rather than just banding or excising a part of it.
And that preservation of the anal anatomy, as you mentioned earlier, is crucial for preventing long-term complications and maintaining normal function. It really is a testament to how far medical technology has come. Are there any common misconceptions or fears that you often encounter with patients when discussing laser treatment, Dr. Fatima?
Definitely. One common fear is that it's experimental or not as proven as traditional surgery. But laser hemorrhoidoplasty has been around for over a decade now, with a strong body of evidence supporting its safety and efficacy. Another is the fear of radiation, because laser sounds intimidating. It's important to clarify that this is a surgical laser, not medical radiation, and it's extremely precise, only affecting the target tissue. And of course, the general apprehension about any procedure in that area is always present, which we address with thorough explanations and empathetic support.
That's vital. Patient education and reassurance go a long way. I think it's also important to emphasize that while laser treatment is minimally invasive, it's still a medical procedure that needs to be performed by an experienced surgeon. The skill of the surgeon is paramount for optimal outcomes.
Absolutely. Choosing a qualified and experienced colorectal surgeon who is proficient in laser techniques is crucial. They can accurately diagnose the type and grade of hemorrhoids and determine if laser therapy is the most appropriate course of action for that individual patient. Not every patient is a candidate for every procedure, and a good surgeon will always recommend the best option for you.
Excellent point. So, to recap, laser treatment for hemorrhoids offers significant advantages over traditional surgery: greatly reduced pain, faster recovery, minimal bleeding, preservation of anal anatomy, and a quicker return to normal activities. It really has transformed the patient experience.
It truly has. It's moved us from a highly invasive, painful procedure to one that respects the patient's comfort and recovery timeline, aligning with modern surgical principles of minimal invasiveness and maximum efficacy. For anyone suffering from persistent hemorrhoid symptoms, exploring laser treatment with a specialist is definitely a path worth considering.
I couldn't agree more. Don't suffer in silence. If you're experiencing symptoms, please consult with your doctor or a specialist. They can assess your condition and discuss if laser treatment is the right option for you. Thank you, Dr. Fatima, for shedding such clear light on this important topic.
My pleasure, Prof. Mahmood. It's been an enlightening discussion, and I hope it helps many listeners understand their options better.
And thank you all for tuning in to Health Unpacked. We'll be back next time with more insights into keeping you healthy and informed. Until then, take care.